So as far as if you're the patient coming in and you have the procedure, what can be expected after that?
You mean in terms of, well, if everything goes well, we
Right.
expect that the patient will live happily ever after for a long time.
Will they stay in the hospital for a couple of days? Or?
Yes, if everything goes well, you know, it used to be that if a patient came to the hospital with a heart attack, they would spend 10 days, 2 weeks in the hospital. If we can open up the artery quickly and the patient has an uncomplicated course, the majority of these patients go home a couple of days, 2 days later.
Okay, and then do they follow up with some kind of rehabilitation, yes, cardiopulmonary program, maybe here at CRMC? Or?
Correct. Well, okay, you know, following a heart attack, there's a host of things that are important to do. Rehabilitation is very important, an exercise program. You know, most of these patients with heart attacks have what is called arteriosclerosis. They have hardening of the arteries due to cholesterol buildup. Many of them are diabetics. Many of them have high cholesterol, high blood pressure. So if they haven't addressed these issues before, it's essential to address them after. Hopefully, you know, they are already doing these things, but yes, this is, you know, they should follow the correct diet. They should have adequate blood pressure control, cholesterol control, and, you know, weight reduction if they're overweight.
Okay. Well, you mentioned the Cath Lab, and we're going to go on a tour and see more in-depth information and view a Cath Lab. And let's talk a little bit about the heart attack signs and symptoms. You mentioned a few of them. Let's dig a little bit deeper, though. Kind of walk us through what we need to be looking for again in preparing us.
The most common symptoms are tightness in the chest,
okay,
heart burning, feeling of shortness of breath, chest pain. Although the majority of patients don't describe this as pain, they'll describe it as tightness. I think an important fact to know for the patients is that, you know, the majority of patients will attribute the symptoms to indigestion. Mm-hmm. And that's a really important notion for the patients to know. Don't try to make your own diagnosis. You know, many patients have died thinking they're having indigestion. So if you're having chest tightness or heart burning, it may be indigestion, but it could also be a heart attack. But those are the most common symptoms. Tightness in this area, okay, the mid-chest. It can go up the neck.
Any arm pain? Or?
Well, the left arm pain is more an urban legend, okay, than reality.
Okay.
Yes, it can go to the left arm. It can go to the left side of the neck, but that's more a textbook description. Okay. The most common symptom is a feeling of pressure. Many patients will describe this like an elephant sitting, okay, on my chest. Okay. Nausea and vomiting, okay, profuse perspiration, shortness of breath. Okay. These are usually the symptoms. Now, in many patients, the symptoms are preceded, okay, days before by some mild symptoms. Okay. You know, if you ask the patients when they had a heart attack, most of them will tell you that, yeah, for the past 4 or 5 days, I noticed a little discomfort and I thought it was indigestion. So I think it's very important for the public to know that if they've never had indigestion in their lives, or if they've rarely had it, and they start having symptoms, especially in relation to physical activities, like when they walk, they get some tightness, they slow down, it gets better, that's probably time to check with your doctor.
Okay. All right. Well, you're located now in a new area, seeing patients, treating patients in the new cardiology clinic. And where is that located? Is that right around from the cardiology, cardiovascular center?
Yes, it's actually a great location. It's on the first floor of Cullman Regional Medical Center, just a short distance from the entrance. And I'm privileged because I have, you know, the emergency room is next door, and the cardiac catheterization laboratory that we'll visit is very close by.
Well, tell us about the staff and those that work around you and your team that are here at CRMC.
Well, I got an outstanding staff. I mean, I've known them, you know, as we've talked. Mm-hmm. I've been coming regularly to Cullman for many years. So we got a superb team in the office. We have a great team in the Cath Lab. It's a small, highly efficient team of very devoted people that all live in the area. They're all, very involved in the community, and I'm extremely excited about the opportunity here.
Well, before we go to the Cath Lab, is there anything else that you would like to add or share while we're here and on location at
Well, I think people probably know it here, but I think this is a jewel of a hospital. And I don't say that just because I'm talking to you. I like it so much that I'm coming more and more often. I think it's a great facility, highly efficient, great location, and I just love to work here.
Well, that's awesome. Well, we're going to venture now to the Cath Lab here at CRMC, so you stay tuned. We'll be right back with more advanced information here about heart care at CRMC. Welcome back to our Health First program today, where we're talking more about advanced heart care here at CRMC. Laura Edwards, Director of Cardiovascular Services, is going to walk us through the Cath Lab here and what that means, and walk through maybe a simulated procedure. So, Laura, thank you for coming on our Health First show today.
Thank you. I'm glad to be able to show this to the community and let them see what type of procedures we do here in the cardiac cath lab.
And how many years have you been operating and been open here providing heart care services?
The cath lab's been open for 21 years here, and we've had cardiac services really for a little over 30 years when we first started with the cardiac rehab program, really taking patients over to West Elementary School and educating them and having nurses and physicians there to monitor their progress, catch their blood pressure, monitor their heart rate. So we've been doing that for quite a while.
So you've seen the advancements in healthcare grow tremendously. Right. Well, walk us through now where we are and what we're doing, and explain a little bit more about what's going on.
When a patient comes to a physician and they decide that the patient needs further testing, they'll have them come to the cardiac cath lab, and they run a specialized x-ray study on the patient to put dye into their arteries to see if they have any blockage in any of the areas of the heart. Maybe that can diagnose a patient that's not getting enough blood, enough oxygen to the heart muscle itself. So, there are multiple people that work with the physician, getting the patient ready. They assist. All of them have different roles, but they work together as a team to get the patient taken care of.
Okay. And kind of walk us through what we're seeing here and
where
we're located.
Well, initially, when the patient comes into the lab, the nurse or the tech monitors their blood pressure, their heart rhythm, and their oxygen content, and they have a program in the computer where they need to document their assessment and looking at medication that's given during the exam, and they document all aspects of the exam. So this is the initial part here, so it's the intake of information. This is an example of a patient's right coronary artery that's blocked from the mid portion all the way to the bottom of the heart. In this next picture, we show where the guide wire has been placed through the blocked part of the artery, helping to see if we can restore the blood flow. So as the doctor injected dye, we did see that it restored some blood flow. After the wire was placed across the blocked part of the artery, we did see that the artery was still narrow, so this needed to have some angioplasty where the physician places the specialized catheter that has the balloon therapy, and a balloon was placed across that area and inflated to where it helped restore blood flow to that area. So in the next picture is where we can see where it restored blood flow all the way through on that patient's right coronary artery. As we come out into the hallway, the